Hi, this is Mrs. Amna, optometrist in Global College of Allied Health. Today I am going to discuss about the topic of lacrimal apparatus. The lacrimal apparatus comprises the structures concerned with the formation of tears, that is the main lacrimal gland and accessory lacrimal glands and its transport. The lacrimal passages include lacrimal puncta, lacrimal canaliculi, lacrimal sac and nasolacrimal duct. First one is the lacrimal glands. The main lacrimal glands is situated in the fossa for the lacrimal glands, is formed by the orbital plates of the frontal bone in the anterolateral part of the roof of the orbit. The gland is divided in its anterior aspects by the lateral horn of aponeurosis of the levator muscle into two parts, which is superiorly orbital and inferiorly palpebral part, which are continuous with each other posteriorly. The orbital part of the lacrimal glands, it is large, about the size and shape of a small almond. It has two surfaces, two borders and two extremities. The superior surface of the orbital part is convex and lies in contact with the periorbita, lining the part of the frontal bone forming the fossa for the lacrimal glands. It is attached to the periorbita by the fine trabeculae. The inferior surface of the orbital part is concave and which lies on the levator vertebrae superioris muscle and the lateral horn of the levator aponeurosis. The anterior border is sharp and seams within and parallel to the orbital margin up to the zygomatofrontal suture. It lies in contact with the septum orbitale. The posterior border is round and becomes continuous with the palpebral part of the gland. It lies in contact with the orbital part or fat. Laterally, the extremes rest on the lateral rectus muscle and medial extremity is related to the levator palpebrae superioris. Next one is palpebral part of the lacrimal gland. It is small and consists of only 2 or 3 lobules. It is situated upon the course of the duct of the orbital part, from which it is separated by the levator palpebrae superioris muscle, which is related to superiorly. Inferiorly, the gland lies in relation to the superior fornix. The gland is compressed from the above downwards and can be seen through the conjunctiva when the upper lid is everted. Posteriorly, it continues with the orbital part. The ducts of the lacrimal glands, about 10 to 12 ducts passes downwards from the main lacrimal glands to open in the lateral part of the superior fornix. 1 or 2 ducts also open in the lateral part of the inferior fornix. Since all the ducts passes through the palpebral part of the gland, therefore excision of the palpebral part amounts to excision of the entire glands as far as the secretory functions of the gland is concerned. The microscopic structure of the lacrimal gland. The stroma of the lacrimal gland, it is formed by mesodermal tissue which contains connective tissue, elastic tissues, lymphoid tissues, plasma cells and blood vessels. The accessory lacrimal glands are glands of Cross, glands of Wolfram, intraorbital glands, glands in the caruncles and clyca semilunaris. Glands of Cross, these are microscopic glands lying in the subconjunctival tissues of the fornices. These are about 40 to 42 in the upper fornix and it is about 6 to 8 in the lower fornix. Their ducts unite to form a long duct which opens in the fornix. Next one is glands of Wolfram. These are microscopic glands present along the upper border of the superior tarsus, that is 2 to 5 in number, and the lower border of the inferior tarsus, that is 2 to 3 in number. Next one is rudimentary accessory lacrimal glands. These are present in the caudicle, plica semilunaris, and infraorbital regions. The lacrimal passages are starting from lacrimal puncta, lacrimal canaliculi, lacrimal sac, and ensign nasolacrimal duct. The lacrimal puncta, these are small rounded or oval openings, one on each upper and lower lids, at the junction of the ciliary and lacrimal portions of the lid margin. Each punctum is situated upon a slight elevation called lacrimal papilla, which becomes prominent in the old age. The upper and lower puncta lies about 6 mm, 6.5 mm lateral to the inner canthus respectively. Thus, when the eyelids are closed, the puncta do not overlap each other, but the upper punctum lies medial to the lower punctum. The upper punctum is directed towards downwards and backwards, while the lower punctum is directed upwards and backwards. Normally, the puncta are not visible unless the lid are averted. The puncta are surrounded by the rings of dense fibrous tissues which keep them patent. With each blink, the puncta slide in the groove between the plica semilunaris and eyeball. The next one is lacrimal canaliculi. The superior and inferior canaliculi join the puncta to the lacrimal sac. Each canaliculi is 0.5 mm in diameter, has two parts, that is vertical and horizontal, which lies at right angle to each other. At the junction of the two portions, there are slight dilatations called the ampulla. The horizontal part of each canalicular converges towards the medial canthus. Each canthus pierces the lacrimal fascia or separated and then unite to form a common canaliculus which opens in a small diverticulums of the sacs called lacrimal sinus of the Mayer. The point of opening into the sacs lies at the middle of the lateral surface of the sacs, about 2.5 mm from its apex. In about 10% individuals, each canaliculus enters the sac separately. Structure: each canaliculus consists of the following layers: epithelium, corium rich in elastic tissues, the fibers of orbicularis muscle. Next one is lacrimal sac. It is located in the lacrimal fossa, located in the anterior part of the medial orbital wall. The lacrimal fossa is formed by lacrimal bone and frontal process of the maxilla. It is bounded by the anterior and posterior lacrimal crest. Lacrimal fascia. The lacrimal sac is enclosed by the lacrimal fascia, which in fact a part of periorbita. The periorbita splits at the posterior lacrimal crest into the two layers which encloses the sac and again meet at the anterior lacrimal crest. Between the lacrimal sac and fascia lies alveolar tissues and venous plexus, which is continuous around the nasolacrimal duct. The dimensions: the lacrimal sac, when distended, is about 15 mm in length and 5 to 6 mm in breadth, with a capacity of 20 cubic centimeter. The parts: it has three parts: fundus, portions above the opening of the canaliculi, body, the middle part, and the neck portions. Is narrow and continuous with the nasolacrimal duct. The lacrimal sinus of the Mayer is a small diverticulum near the middle of the lateral wall, into which opens into the canaliculi either together or separately. The relation to the lacrimal sac is medially. It continues with the lacrimal sac's anterior ethmoidal sinus in the upper part, and towards the middle it is in contact with the meatus of the nose in the lower part. Anterolateral relations of the sac are from the deep to superficial includes lacrimal fascia and few fibers of the inferior oblique muscles which arises from it. Lacrimal fibers of the orbicularis muscle, that is Horner's muscle, medial palpebral ligaments which covers only the upper part of the sac. Therefore, distension of the sac always occurs in the lower parts, which is covered by the new fibers of the orbicularis and the skin. Lacrimal abscess and fistula also open in the lower parts of the oving to less resistance. The palpebral fibers of the orbicularis. The nasolacrimal duct is continuous downwards from the neck. It continues downwards from the neck of the lacrimal sac to its opening in the inferior meatus of the nose. It is about 18 mm in length and about 3 mm in diameter. The upper end of the nasolacrimal duct is also narrowest part. Direction of the nasolacrimal duct is downwards, backwards, or laterally. Externally, its location is represented by a line joining inner canthus with the aloe of nose. It consists of two parts, an introcaeous part and intramedial parts. The introcaeous part lies above the bony nasolacrimal canal, which is formed anterolaterally by the maxilla and posteromedially by the lacrimal and inferior nasal concha. The nasolacrimal canal lies lateral to the medial meatus and produces a rigidity in the maxillary antrum. Therefore, lesions of the maxillary sinuses are often cause epiphora. Inframedial part of the nasolacrimal duct lies within the mucous membrane of the lateral wall of the nose. The opening of the nasolacrimal duct in the inferior meatus is situated at the depth of about 30 to 40 mm in the anterior nas. The pathway of tears, that is lacrimal glands. From lacrimal glands it produces the lacrimations, that is tears, which continues to the lacrimal duct through the superior and inferior conjunctival fornix. It reaches the lacrimal punctum, lacrimal canaliculi, lacrimal sac, nasolacrimal duct, and finally inferior meatus of the nose. The blood supply of the lacrimal gland, superior and inferior palpebral arteries are the branches of ophthalmic artery, angular artery, infraorbital artery, nasal branches of the sphenopalatine artery. The nerve supply, sensory nerve supply to the lacrimal sac, the nasolacrimal duct supplied by the infratrochlear nerve, anterior alveolar nerve. Thank you.